Hello, I'm Dr. Christina Hibbert, and this is 3-Minute Therapy. Today I want to talk about going beyond postpartum depression to the spectrum of disorders that can occur in pregnancy and postpartum. And specifically today I want to talk about the most misunderstood of these disorders, which is called Postpartum Obsessive-Compulsive Disorder, or OCD. Postpartum OCD affects 3 to 5% of women according to research, and some estimate those rates may be even higher. Symptoms include obsessions, like mental pictures in the head, images, or thoughts. Usually these thoughts or images revolve around seeing harm come to the baby. For instance, many women might, whereas a mother without postpartum OCD might walk past the stairs and wonder, oh my gosh, what if my baby fell, and be afraid and hold the baby a little tighter. Postpartum OCD moms would actually see a picture in their head, almost like a movie, and it might involve the baby being flung over the side or falling over the side and being smashed on the floor. Or when they're cooking, they might see a knife slipping and cutting the baby. They see it like a picture in the head, even though they're nowhere near the baby or they have no intention to do such things. These obsessions, of course, can be very, very scary, and they lead to compulsive behaviors, which is the second symptom, compulsions, to try to relieve the anxiety associated with these mental images, pictures, and thoughts that can come. The compulsions typically involve things like checking on the baby or hiding things that they feel might harm the baby, like burying knives in the backyard, making sure that the baby is a safe distance from the mother so that she can kind of take care of the baby without getting too close, because she might be afraid that she might actually, one of these visions might come out to play. Some mothers are one of their compulsions is maybe not wanting to sleep near the child because they're afraid in the night they might wake up and do something. These women have extreme anxiety over these compulsions and obsessions, and that's the third symptom, which is important because it distinguishes postpartum OCD from the more dangerous and life-threatening, potentially life-threatening psychosis, which affects only about 1 in 1,000 mothers. In psychosis, mothers do not know that their symptoms are bizarre. They do not understand that what they're thinking is abnormal, and so it does not cause them distress. Whereas in OCD, these mothers are well aware that what they're seeing and what's happening in their mind is not okay, is not something they want, it's not anything that they've ever thought they would ever believe, or it's nothing they believe or even want to think or feel. Instead, these images just come intrusively. They intrude upon the mother, causing her great distress, which is a good sign because it means that she has the OCD, and OCD is treatable. Now, I hope more people can talk about this disorder. The more we talk about it, the more we can help the mothers who need us, we can help them understand that they're not to blame, that this is not their fault, that it's a misfiring of the chemistry of the brain, and that yes, they need treatment and help, but that with the proper diagnosis and treatment and care from people who specialize in these types of disorders, these mothers will make a full recovery. And in fact, they're some of the best, most dedicated mothers I've ever worked with. That's a little bit about postpartum OCD. Join me next time as we talk a little more about this topic here on my 3-Minute Therapy series, and definitely visit my website, drchristinahibbert.com, for more on this topic and other postpartum and other issues. Thanks. Bye-bye.